For those of you I've not met, my name's Bob Klaber. I'm a paediatrician and Director of Strategy at Imperial College Healthcare in northwest London. And a real honour to be facilitating this next hour or so we've got together before lunch. 3 parts to the session. We're going to hear from the Right Honourable Victoria Atkins, our Secretary of State for Health and Care, with a speech. We're then going to try and have a sort of 15-minute or so psychologically safe conversation and chat away. And I think Sam illustrated earlier that, is there a harder job in the world than being a politician around psychological safety? We're going to have a good go at that. And then we're going to have 20 minutes or so with Q&A before the rumbling of tummies means that it's lunchtime. So I hope that gives you a sense of what we've got ahead and a bit of a role to build on the themes that have been discussed. So without further ado, a real honour to introduce Victoria. So the Right Honourable Victoria Atkins, Secretary of State. Victoria.
Thank you, Bob. Well, good morning, everyone. Can I say what an absolute pleasure it is to be here at the Nuffield Trust. This is one of those landmark moments in the calendar of a Secretary of State for Health. I know that I'm about to be scrutinised and indeed cross-examined by some of the country's leading experts in healthcare. So believe you me, this makes Jeremy's outing at the budget yesterday feel very easy in comparison. But can I thank the Nuffield Trust for inviting me to speak to you today. It is a great honour, but it's also actually a privilege because the National Health Service is genuinely one of the reasons I came into politics. And today, having the, if you like, privilege of speaking to you who work in healthcare, but also who are very, very conscious of its future, of the challenges we face today, but also our determination to prepare it for the years and the decades to come. I would like, if I may, to have a little bit of intellectual freedom to look at its future in a different light from that we tend to hear. Our national conversation around healthcare has tended to focus on older people who are living longer and with more health conditions. And indeed, later this afternoon, the Chief Medical Officer, our wonderful Chris Whitty, will outline how we're supporting them to live more independently and with more years in good health, and rightly so. But I think there is a set of voices that is not heard often enough, and that is the voice of young people. Young people not only pay for the NHS of today, but they will also, of course, use the NHS of tomorrow. And we know that the high costs of living, rising rents, and so on are making it difficult for our young people to make those long-term decisions that are so important to us all, such as buying a house or starting a family. We cannot, therefore, expect them to foot the bill for an infinite increase in healthcare spending. The Chancellor's budget yesterday rightly recognised that we cannot continue to have a larger tax burden falling on a smaller number of working people. For me, the path we must take is obvious. We must build a more productive state, not a bigger one. And indeed, research proves this point. Today, there are 3.3 workers to support every pensioner. In less than 50 years, there will be fewer than 2 workers to support every pensioner. So we need to stop the next generation being dragged into a tax and spend black hole, where they put more in to get less out. Because this is a recipe not just for them losing faith in the institutions we hold so dear, but also, I'm worried, losing faith in capitalism and losing faith in our democracy. But the decisions we took in yesterday's budget will make a meaningful difference. We took decisions that will reduce long-term demand and improve productivity, not just through the NHS, but across the economy. Because the two go hand in hand. A strong economy helps pay for the NHS, and a strong NHS supports a growing economy. So today I want to share our plan to achieve both of these things through productivity and accountability. But before I do that, there is, of course, one topic that is fundamental to my plan to reform the NHS to make it faster, simpler and fairer. And that is prevention. In the coming weeks, I will set out further thoughts on this very important topics, but I hope you'll forgive me. Following yesterday's incredibly significant announcement in budget, I want to focus today on productivity and how it will make the meaningful changes to the NHS that we all want to see. Now to productivity. I know that you've heard about this already, and indeed Thea Stein has observed that NHS staff and clinicians don't get out of bed in the morning thinking about how they could be more productive. I get that. They are motivated by doing the very best they possibly can for patients. And that is, of course, the way it should be. So when I talk about productivity, this is not about telling staff they need to work harder. It is about giving them the tools and the time to give patients the best care they can. Now, we know that the NHS can be more productive. From 2010 to the start of the pandemic in 2020, productivity growth in the NHS outstripped the wider economy by more than 1% a year. But since then, it has gone into reverse. Now, the causes are complex. The pandemic has clearly increased demands on staff, and spending on agency staff has risen as a result. Our long-term workforce plan, the first in NHS history, will get this spending in check, reducing it by as much as £10 billion over time. And we should also be frank about the significant problems and pressures that industrial action has caused across the system, including, sadly, the 1.4 million appointments and operations that have been cancelled since strikes began in December 2022. Nonetheless, a reasonable and fair deal can be struck, and I'm really pleased that unions are recommending our new offer to NHS consultants. Should their members accept this deal, and I hope they will, we will all be able to move forward with providing patients with the care they need and see waiting lists fall. But the budget will deliver savings for everyone who works in the NHS. The 2p cut in national insurance will grow the average nurse's pay packet by more than £500 a year. This is on top of the national insurance cut we have already delivered this year, which taken together will benefit the average worker by over £900. But the budget went further. As well as helping the NHS meet the pressures it will face in the coming years with an additional £2.5 billion, it set out our determination to return to the productivity we all know the NHS has and indeed can deliver by funding a £3.4 billion capital investment plan to invest in technology. The productivity plan, along with the long-term workforce plan, will see productivity grow by 2% per year, meeting and exceeding the growth we saw in the last decade, and unlocking £35 billion of savings by the end of this decade. We will digitise operating theatres, opening up an extra 200,000 operating slots a year. We will set up a new NHS staff app, making it easier to roster electronically and ending the use of expensive off-framework agencies. We will update IT systems, giving our doctors and nurses millions of hours back to spend with patients rather than hospital computer screens and computers on trolleys. We will support every hospital to use electronic patient records, making the NHS the world's largest digitally integrated healthcare system. And we will improve the NHS app so that patients can use it to confirm and modify all appointments. This will increase choice, reduce the number of missed appointments by 500,000 every year, and make the NHS app the front door for prevention as well as for cure. Somewhere where patients can book vaccines and access all their preventative tests in one place. This productivity plan will make life simpler for staff and cut waiting lists for patients. And it is our responsibility, indeed I would go so far as to say it is our duty, to prepare the NHS for the future. This is why we want to seize the opportunities of AI for the benefit of our health. It has already revolutionised stroke care across the NHS, halving the time it takes to treat people and tripling the number who recover to reach functional independence. And we will use AI to potentially cut in half the form filling by doctors and nurses and upgrade over 100 MRI scanners across England so that more than 130,000 patients a year can receive their results faster. This will allow them to start treatment sooner, free up clinicians to spend more time with patients who need them most, and save taxpayers money. And so that's what I mean when I say that technology can make our NHS faster, simpler, and fairer. As well as improving performance across primary, secondary, and community care, technology can also strengthen social care, keeping people out of hospital and helping them live well at home. This is what the Accelerating Reform Fund is all about. It provides local authorities with £40 million of government funding to invest in the most innovative new technology to help look after older people, whether that's through introducing new digital tools to boost recruitment and retention, or increasing social prescribing, which can reduce costs and help people build connections with their communities. Our long-term workforce plan set out that NHS productivity growth of between 1.5% and 2% was possible, and thanks to the productivity plan we announced yesterday, Amanda Pritchard has committed to delivering 2%. It will be challenging, but if we work together, we can get this done. But I also want to send a clear message about accountability. Trusts, ICBs, regional boards and NHS England are responsible for billions of pounds of taxpayers' money. This is not our money, it's not government's money, it is the money that all of our nurses, our porters, our receptionists, as well as shop workers, waiting staff and the self-employed have earned and then paid to government from their wages. It is therefore our duty to ensure that this money is spent as well as possible. Poor performance cannot be tolerated, and good performance must be rewarded. To achieve this, by the summer, NHS England will start reporting against new productivity metrics, not only at national level, but also across integrated care boards and trusts. And I want us to go further, because I've listened to you, by introducing new incentives to reward providers that hit productivity targets. So I want to see providers retain the surpluses they generate through productivity improvement and reinvest them in frontline services to support the clinicians who made these savings possible. Now, of course, accountability extends beyond productivity to all of the work that the NHS does. I've been very honest, actually, about my own experiences of the NHS. I've received great care, but I've also seen some of the darker corners of our health system. And this technology and the data it will produce can be used by the public as well as professionals to shine a light on poor care. Care will no longer just be scrutinised by committees of MPs in dusty, ancient committee rooms in the Palace of Westminster. It will also be scrutinised by the public on their phones. This is what digital natives expect in every other area of their lives, and healthcare should not lag behind. Now, we're already making progress, and people can find out how their local trust is performing with a few taps on a screen. Quite rightly, the public expect to receive the best care, and that care should not be prescribed by where they happen to live. And I say this, of course, as a proud Lincolnshire MP, which is, believe you me, a very different healthcare proposition from, let's say, central London or central Birmingham. Postcodes can still determine the speed and quality of care. This is seen starkly in waiting lists. The long hangover of the pandemic must be tackled, and waiting lists must be cut. Yet half of the NHS's longest waits are concentrated in just 15 trusts. And in those trusts, the longest waits are centred on particular specialties, such as gynecology or orthopedics. Now, we are giving patients who have waited the longest times the choice to transfer to another provider. But that cannot be the only solution. And so my ministers and I are working with NHS England to support those trusts to improve, but also to hold them to account. In urgent and emergency care, it's a similar story. In January, just 15 trusts made up over half of the hours lost to ambulance handover delays. And just 13 trusts met the interim target to deal with 76% of urgent and emergency patients within 4 hours. This can and must change. We have a range of tools to help trusts, from support from NHSE to lending resources and people, as well as peer support, because of course we all recognise that that is often the best way to drive up standards. And there should be rewards for success. That's why NHS England will once again offer additional capital funding to trusts who exceed their emergency targets. And if I may, just a moment, I've been concerned when I hear of a few, only a few, ICB leaders who apparently do not consider it part of their job to speak to local members of parliament, people who represent local communities, or to explain their funding decisions. As someone who is, I promise you, very accountable to the public, we have to recognise that as public services are funded by the public for the public, that attitude is not acceptable and must please change. Now, as part of my focus on spending taxpayers' money well, I am bringing commercial expertise into the Department of Health and Social Care to help drive results for us as a department. Steve Rowe, the former Chief Executive Officer of Marks & Spencer's, has led a lot of work within the department to streamline our processes. And I'm delighted today to announce that Steve is joining the department as one of our non-executive directors with a remit to accelerate delivery and ensure that the productivity plan, which is fully funded, improves care throughout England. Now, I started my speech with young people and the pressures that they face, but also the need to meet the future with confidence. We can do this. We are standing on the cusp of a medical revolution where technology, personalised therapies, and better data can transform outcomes for a generation who are more health conscious than any that came before them. The NHS, and indeed we, must seize this opportunity and look to the future, not restrict ourselves to what has always been done. In fact, it needs to have, to borrow a phrase, an M&S moment. This much-loved British brand, a stalwart of our high street for decades, realised that change was needed and embraced modernity, pivoting towards the next generation, winning them over and securing its long-term future. This is what the NHS needs to do to make sure it's there for the next 75 years, just as it has been there for us. And as I've seen on visits to hospitals, GPs, dentists and pharmacies up and down the country, the people working in the NHS have the drive, the dedication and the determination to build a brighter future and therefore support a stronger economy for the next generation. In conclusion, this is because this isn't just any health service, it's our national health service. Thank you all very much. Thank you, Bob.
Fantastic, thank you. A glass of water and have a breather for a minute. So we're going to ignore all this lot for a minute if we can and have a bit of a conversation. When we first met and were getting mic'd up, we were talking about, I guess, productivity and performance and thinking about our teams and the people who work around us. And we sort of smiled at each other and said, neither you or I have an issue with productivity and accountability of the teams around us. And the reason for that is we set out a clear vision and we create space where these totally amazing people around us can get on and go and do the things they're brilliant at. And the issue is sort of sending them home late at night to say, don't work so hard. I guess when I think about that more widely and hearing what you're saying there, how do we magnify that across all of our teams working across 1.3 million people in the NHS?
I mean, what an amazing number that is to begin with, 1.3 million people who each and every day are looking after 1.3 million patients. And for the overwhelming majority of those 1.3 million patients, they will get good care. But we know, of course, there are times, very sadly, and which we do not accept, there are times when that care falls below where we expect. And so my message, as someone, as I say, who's been steeped in the National Health Service since the age of 3, I've had the joy of meeting many, many clinicians, many nurses, many professionals in my time. But also, I've got lots and lots of friends who are doctors and work in the NHS. Believe you me, they give me their views on a regular basis. What I think actually it comes down to is this idea that when we think of the NHS, we think of care. We assume we are referring simply to patients. Indeed, that word care needs to be at the heart of our system for our people, for our staff as well. And one of the things I have been most interested in and determined to help support NHSE and leaders up and down the country is the concerns that we hear, particularly from our younger members of staff, about working conditions, about well-being. I really want to do more to help the well-being and the working conditions of our young people. So, for example, a junior doctor I met in a hospital explained to me that they had tried to book time off for a friend's wedding a year in advance. And they only found out sort of 10 days before that they weren't going to be given the time off. Well, that is not a proper way to treat people. I appreciate it's very difficult creating rosters, I get that, but actually if we want to help keep, retain and enthuse our younger members of staff, as well as people who have been in the system for much longer, then we have to try and help them with things like that. So I'm working with Amanda Pritchard on a series of sort of well-being and working condition ideas that we want to test with our workforce. We want to ensure that we are trying to address some of the issues they face. And I genuinely think that the long-term workforce plan, coupled with the productivity plan, will be some of the ways we really will achieve this.
And I guess I've kicked around as a paediatrician for 25 years or so. Our track record on that, going back really over that time, is not good. We're very top-down. What I watch, I get the privilege of hanging out with lots of young people as patients and students and others, and they have such hope and vision, and they're just the sort of people you need to achieve everything you were talking about. But then they get into the health service, and pretty quickly they feel they have much less agency. People aren't really listening to them. The sort of levels of permission around it feels hierarchical, it feels top down. The difficulty is the politics and sit where Amanda sits and things, that feels like it comes raining down. And that might not be the intention. I guess, how can we work together around really trying to change that? Now, that may feel impossible. People in the audience go, well, that's impossible. But the hopefulness in me is we've got to get to a space where we can really let people get on. Because I think they know I work with, they know what to do. They know what care's about.
So there's an interesting debate here, because obviously, being as accountable as I rightly am to our good friends in the free press and indeed the public, the debate around targets, we know why we want to meet certain levels of expectation, but I can also see that sometimes that can reduce the autonomy that local leaders, including, of course, very senior clinicians, feel that they have on the ground. I think I'm hoping that the very strong message coming from both Amanda and me on this well-being point and working conditions, from that I think many things can flow. I mean, we've had the staff survey out today, and forgive me, I haven't had a chance to pore through every detail, but I think it's fair to say in a lot of respect we're beginning to seeing corners being turned in terms of pressures on staff. Much more to do, of course, I accept that. But that, if we're able to have these open conversations about what we not just expect of our staff, but also what we want to do to support them, that will help change the attitude. And I come at this from, I spent 20 years working at the criminal courts, working with police officers and other law enforcement officers. I've spent time as safeguarding minister looking after victims of crime, some of the most egregious crimes, but also as prisons minister working with incredibly conscientious and dedicated public servants who work in prisons. I really do think that if we're able to lead conversations about well-being, what we want, how we want our people to feel in the workplace, then that will begin to see the change in culture. But it does need, please, trusts and ICBs to work with us on this, because of course they are the ones that hold the local levers.
Yeah, and I guess a big theme of the conferences about the summit is trust and relationships that happens at lots of levels.
Yeah.
Can I go to, it was great listening to you and sort of hearing lots of things being sort of set out. It got with my sort of strategy hat on, thinking about where does that get us in 10 years? So I guess I've got a wonderful project that I'm doing locally and around St Mary's called 2035, which is focused on thinking about wider determinants of health, over the next 11 years, how can we improve people's lives together, working with partners? If you fast forward, like you and I sat here in 2035, I doubt I'll get invited back, but you never know. What can we expect? What's in your sort of hopeful moments around things? What can we expect for the health and well-being of this country in 11 years' time?
So we look at our plans, look at the long-term workforce plan. That is a very long-term view on what we want to do to recruit, retain, look after our staff, the plans for more doctors, more nurses, but also the way that we encourage people into the workforce. For example, medical apprenticeships. For example, the use of making sure that we're helping nurses retain and make sure that we're really looking after them and the skills they bring into the workforce. These are all set out in our plans, and what is more, it is fully funded. So you have the confidence of knowing that we absolutely are determined to deliver on these stages of the long-term workforce plan. And yesterday's productivity plan is so significant because this is the first time, I think, in the NHS's history where we have been able to say, alongside delivering tax cuts, we have also been able to say we are going to invest this enormous amount of money into tech because we have listened to you all, we've listened to leaders, we've also listened to nurses and doctors on the wards during the day about how having antiquated computer systems on wards holds you up. It's incredibly frustrating. It's not why you came into medicine. Well, then, let's sort that out, as well as the very exciting opportunities of AI that are coming down the train tracks to us. I mean, I don't think we've quite had a full public conversation yet about what AI will mean for healthcare. I think we're beginning to see signs of it in the States. And so, for example, the voice-activated AI, which is part of our plans for this productivity plan, this will mean that, you clinicians, consultants, have your appointment with a mum and her child, and rather than after that appointment or conversation having to go and type up for 20 minutes, as you yourself said, the notes will be created, thereby cutting down the amount of time you have to spend tapping into a computer. And look, you did not spend goodness knows how many years developing, training, etc., to sit there typing. So we want to free you all up to do the work that you've trained so hard for and continue to develop as you progress through your careers. I want you looking after patients, not looking at computer screens.
And just on that, there's a load of patient leaders and representatives of patient groups in the room, and talk about a sort of a public conversation about AI. That sounds like a brilliant idea to me. How do we go about that? That feels urgent, actually.
Yeah, it is. And the word that you used is critical to this. So trust. We know there has been a very checkered history of massive digital infrastructure programs, particularly in healthcare, that have destroyed the public's trust and destroyed also the trust of the workforce. So to me, we have to do this very much working in step with patients and the public. For example, the rollout of the Federated Data Platform. You know, the wonderful Bruno from Chelsea and Westminster who helped design that. He is an absolute advocate for this, and there were many people in the room who've worked very hard on it as well. And we know that that has huge benefits operationally within hospitals, but we need to make sure that patients understand how we are looking after their data, because nobody wants a data breach, it goes without saying, but also the people who are using it will be using it for the right reasons to improve their care. And so I think there is a real need to bring earn people's trust on this so that we can move forward with some of these really exciting projects.
Great. In fact, one final bit from me before we go to some questions. I'm going to try and bring three things together. So innovation, and that sort of really came through in your speech. I guess the issues about your piece about fairer care and health inequalities and equity are worrying lots of us in this room. And then also prevention, and you rightly said, sort of, you know, one for, I guess, a conversation in weeks ahead. One of the worries I've got is when you look at things like children's teeth and getting a more preventative space, or these amazing obesity drugs, say, that are coming on in, that we're not really being sort of brave and strong enough and ambitious enough around it. And I worry that actually the risk is it'll widen those inequity gaps. So the access to innovation, if you look at research trials, we're not great on the equity piece around that. Just some final thoughts on that before we open up.
This is actually where our system of democracy, I think, is better than any system in the world, because not only am I Secretary of State for Health, but I'm also the Member of Parliament for Louth and Horncastle, which is a corner of Lincolnshire. If you don't know Lincolnshire, you may not be familiar with its exact geography, but I have both, I've got, you know, very beautiful market towns, but I also have some of the most deprived wards in the country. I have in one of my coastal towns the highest rate of type 2 diabetes per head of population. And so every single decision I make as Secretary of State, I have in mind, how will this help my constituents in Lincolnshire, but also constituents in the southwest, people living in Blackpool? How will this help those communities that we know are struggling with some of the biggest health disparities that exist at the moment in our country? And so that is why I came up with my founding ethos for my what I want to do with the NHS: faster, simpler, fairer, because there are some genuine challenges around healthcare access in our rural and coastal areas, but also within groups of population. So I announced as one of my priorities is women's healthcare, because I think we all know that there are instances where women's healthcare has frankly not received the attention it should have done in decades gone past. And the wonderful Leslie, as my women's health champion, is an amazing advocate for this. But what we want to do is, I've invested £50 million worth of research into addressing maternal disparities, because if we can help women with their health before they get pregnant, and so they have better health outcomes for them and their babies, that is a win-win all round. But the point about health disparities, I genuinely think, I mean, I'll give you you've used the example of children's teeth. For those who have not read the dental recovery plan that we launched a couple of weeks ago, you will see in there's a section on what we're calling Smile for Life. And this is work that we're doing with mums-to-be in family hubs, but also parents in family hubs when they're babies, teeny tiny, before they get to school, making sure that mums and dads, but also children are beginning to understand they need to brush their teeth every day. It's a fun thing to do. That is, again, fully funded through the Dental Recovery Plan, because, of course, we want to help improve dental health for our children, prevent them from having problems in the first place, so they've got a smile for life. So there's a lot of work going on to do with prevention, and it's such a critical piece, because what I want to do is set in place the foundations for bending that demand curve in the years ahead, because, again, that's how we're going to ensure that we as a country can continue funding the NHS as well as we want to, whilst it continues to become more productive and more responsive to what we expect.
Fantastic. I'm going to look forward to loads of children's health stuff in the prevention work to come. We've only got sort of 120 hands on up here. Look at them all go up. I'm trying to see where the microphones are running. Should we go to the lady in the middle with, I think, a dark blue dress, giving us a wave there? Come on, start there.
If they can say their name.
Yeah, and thank you, Victoria. Please stand up to let us know your name and where you're talking from.
Thank you. Thank you, Victoria. I'm Ruxana Kapasi from Barnardo's, and I'm a non-exec director of a community health trust as well. And it was great to hear your commitment to children and young people, and you starting with that and ending with that. I think the reality is that we really do need a long-term strategy in terms of funding child health because of the huge crisis, that we've got at the moment. We've slipped 30 places in the world rankings for height for children due to malnutrition and poor diet. We know that kind of waiting lists are at a record high in community paediatrics for speech and language, autism, etc. And I think one of the challenges that we have is that the funding for children's health is not protected in the same way that it is around maternity, that it is around mental health. And it is so fragmented around primary care, secondary care, acute care. So when integrated care systems really think about that population health approach, around how can we meet 30% of the needs of our population, it is a real challenge. So my question is that, how can we, within this context of the fragmented funding, really achieve a very coordinated strategic approach to children's health and then multiply that 42 times across each ICS?
Well, thank you. Ruxana, and I've done a lot of work with Barnardo's, both in a safeguarding capacity, particularly in helping victims of child sexual exploitation. Barnardo's does a great deal of work with that. So I guess I would throw the question back at you a little bit. So first of all, the figures on height, I know my opponent called our children short and fat in a media round. I was a bit surprised by that, but we don't quite accept those figures on height. But let me talk about healthcare as a whole. So one of the things I suspect, I haven't seen his speech, but one of the absolute driving missions of the Chief Medical Officer is that we have to stop siloing people according to their conditions. So one of the reasons why we will be launching in due course the major condition strategy is acknowledging that people, particularly as they grow older, they can have a number of different conditions, and rather than receiving 10 appointment letters to the local hospital for whichever checkups you need for each condition, we should really try to be integrating care around the person. I absolutely understand why you asked that question about children's care. I suppose my worry is if we try to silo children in the way that you've discussed, that I think, in fact, we're almost, if you like, removing them from what should be part of our national conversation about healthcare. And I say that, I genuinely say that from a patient perspective, because as I say, I was diagnosed with type 1 diabetes at the age of 3, and I was very conscious of the difference between children's services and then the move into adult services from the age of 18. So I guess what I think the challenge for us is to say, how do we emphasise at local level, including ICBs, how do we emphasise that they cannot and must not think that local services can somehow, there is not as much of an emphasis on children and young people's services as there would be for the adult population. I do think we're beginning to see some really interesting work, by the way, in terms of mental health conditions and our younger people. We are not there yet. I don't pretend we are, but we from some of the figures that we're seeing coming through, our emphasis on, for example, mental health support in schools, we've got 44% of schools covered now. That is beginning to have real impact. And so I guess what I'm trying to say to you is that I don't want to silo children. I think that's wrong, but they absolutely must be recognised across the system as an essential part of our healthcare. They should not have, their voices should be heard, and the voices of their parents should be heard as well.
Okay, fantastic. We're going to have a question at the front.
Hi, Laura Donnelly from the Daily Telegraph.
Hi, Laura.
I was struck by what you were saying about Marks and Spencer's, and I just wondered, could you enlarge on what it is the NHS could learn from M&S? Sort of particularly struck this week, I think we've got a current M&S boss who really laid into the government, talking, saying it was like running up a downstairs escalator with a rucksack on your back, which I thought some people in the NHS might also relate to. So I just wondered, again, can you speak to, we've got these targets now to improve productivity. Can they be met while the junior doctors are striking? What's the kind of balance there in terms of cutting waiting lists, hitting productivity targets when you've got the strikes costing, $2 billion and running? And the other thing, you briefly touched on the prevention agenda. And I just wondered, do you think that people have got a duty to try and be healthy to help save the NHS money?
All right, well, Laura, thank you for that. First of all, look, I love M&S and very happy to welcome Steve Rowe, as I say, into the department. And by the way, the reason we're doing that is precisely because of the turnaround story that M&S has experienced in the last 5, 6, 7 years, whereby it's fair to say they were in the doldrums and we were all worried about stores closing. Now, many is the time I've had a conversation with colleagues admiring their beautiful new jacket or whatever, and they say, oh yeah, it's M&S. And it's because they have taken, they've listened to what their customers have said, but they've also acknowledged they need to move forward. And I think that bringing Steve into the department, helping us with the productivity plan, but other forms of delivery as well, it will be a very significant step forward. In terms of our commitment to the productivity plan, it is fully funded. There is a reason why yesterday I was delighted to be sitting quite so close to the Chancellor. It's because not only did he deliver tax cuts, he also managed to invest nearly £6 billion in our National Health Service. That is a clear commitment from us as a government to our National Health Service. But it is also responding to what professionals in this room have told us about what they need from technology. So both the basic day-to-day technology, but also the fancier AI and more innovative technology, that is what we think will bridge that gap. As I say, it is absolutely our commitment. It's one of the biggest commitments we made in the budget. We want to deliver this. We want to prepare the NHS for the future. And I do think, as part of, you mentioned strikes, look, I very much, as I've said, very much welcome the union's support and indeed recommendation to their consultant members about the deal at the moment. I hope I'm not speaking out of turn, very good working relationships with other union leaders. I hope that the Junior Doctors Committee of the BMA are able to come back with some reasonable expectations. I've said this throughout, and I want to open up that conversation about working conditions and well-being, because as I say, not just from meeting doctors on all my my travels around the country, but also my friends who are themselves doctors. I get that some of these working conditions can be a real difference between people feeling valued and an important part of their local clinical team, rather than feeling very disenfranchised. So I'm hoping that we can find some really good and common ground on how to help with some of that. In terms of prevention, as I say, I'm going to set out more. I hope you'll understand today. I really wanted to focus on productivity. But in prevention, I think, I've said before, I find this idea that we have sort of, I do not agree with the finger-wagging approach, because as a patient, I don't think it works. And so what we have to do is support people into making healthier decisions. And by the way, our younger generations are much more health conscious than they were before. We need to help them with what healthy looks like. I'm very conscious as well that the pressures of social media can have on young minds as to what they think their body image should be and so on. We've got to help them understand what healthy looks like. And I think we can do that through both guidance and nudging and some of the ideas you'll hear about in due course. I do think we can achieve that. We don't have to be constantly telling people off and calling them short and fat. I don't think that works.
Great, so I have time for a couple more. We're going to get, I think, Steve, it's right in the back, in the grey shirt. It's quite hard to see you guys from here. And I think we've probably run out of time for anyone online, but I'll keep some eyes out for one more.
Thank you, Bob. It's my best blue stripy.
Oh, blue stripy. Apologies.
Thank you, Bob. Thank you, Secretary of State. I think we are right to focus on productivity. I think value is a term probably that the NHS is more comfortable with. In terms of where we focus innovation, I think we can create marginal gains by focusing on technology for clinicians. And this might sound like an odd thing for a clinician to say, but I think actually the greatest increase in productivity or value is going to come in the patient-facing space. I went on a study tour to America once, and a great public health leader called Don Kemper said that the patient is the greatest untapped resource in healthcare. And that's absolutely true. So to keep me healthy, I have Strava, but I don't have anything from the NHS. I have the NHS app, which helps me order my repeat prescriptions, but doesn't really offer me much more than that. And I have nothing really to help me manage my asthma or my psoriatic arthritis. Whereas in the world of type 1 diabetes, there's some great technology. So we need tools, patient-facing tools, to keep people healthy. We need really good symptom checkers at the front door of the NHS. I tried NHS 111 online once and thought it was pretty awful. But we don't have anything when I'm on triage in a GP surgery to help the patients manage their symptoms. And we need something for frail older people. My 88-year-old mother is great on our family WhatsApp, but I don't think she has anything that helps her interact with the NHS. So I think we barely scratched the surface of technology to support patients, and I hope that you'll have at least as much focus on that as on technology supporting clinicians. Thank you.
Steve, this is a great question because I can say an enormous yes to you. So part of the £3.4 billion announced yesterday is investment for the NHS app to make even greater strides than we are making at the moment. So one of my favourite facts at the moment, more COVID vaccinations were booked via the app over this winter than using the telephone. And the majority, or the most common user of the NHS app is not, in fact, younger people, it is pensioners. So there is enormous potential with the app. We already have 3 out of 4 adults with the app on their phone. That, you speak to any tech business, that's a pretty respectable place to be in. And what is more, over the last month, whilst I've been Secretary of State, we've been able to announce the rollout of repeat prescriptions on the app. That will save the average patient 18 minutes to fill in their repeat prescription. It saves GPs, practices around 3 minutes per prescription. So you can begin to see where if we can make great changes in the app, that in itself, as you rightly identify, will mean that patients get to see some real benefits. In terms of where we're going next, I want to roll out scanning through this. Later on in the summer, you're going to see more and more items being added to the app. And so you will get to this place very, very quickly. But we want to go further, which is why we've announced more than £400 million investment in the app in order to make it as user-friendly as possible. And you've rightly identified medtech. One of the things that we don't ever seem to talk about, and I encouraged various journalists after the budget yesterday to try and focus on some really good news stories for UK PLC that don't often come out, is our life sciences industry, including medtech. The Freestyle Libre device that you're talking about with type 1 diabetes, which I'm wearing at the moment, that was developed and that is manufactured here in the UK. Just in Oxfordshire. That is an extraordinary device that has already revolutionised diabetes care in the UK. But our life sciences sector is critical to this, which is why the announcement yesterday that AstraZeneca is investing not just in Cambridge, but also in Liverpool with their vaccination, creation, manufacturing facilities. That is an enormous boost of confidence in us as a medically advanced, but also forward-looking economy when it comes to medicines and medtech. And so that, I genuinely think we're on the cusp of a medical revolution, as I say. I don't think we have quite explained this to the public yet, and I think that is on me, but also please on local health leaders to explain this, because when I look at where we will be in 5 years' time, let alone 10 years' time, our healthcare will be being delivered in very, very different ways. And we need all of us to, I think, acknowledge that, but also to build the trust Bob, that you rightly raised earlier on.
Great, thank you. We're going to have one last little question, and it's going to be really short and pithy. It could have come in here. You've got a mic. That makes life even better. Well done.
Hi, James Owen from Health Service Journal. I just wanted you to elaborate a little bit on the productivity gains for trusts, the incentives there. So you said that there'd be incentives for providers to hold on to productivity surpluses generated by productivity gains. Does that mean you're going to give trusts freedoms back to some of the freedoms that they've had over surpluses in previous years, but have sort of been brought back a bit in recent years?
So, thank you, James. So the one, again, listening to you as carefully as I do, I get the point that for those trusts, and for those trusts whose staff have enabled them to meet, for example, the 4-hour target in A&E, it can feel as if that very, very hard work, that commitment, that ingenuity that is often involved in achieving those targets, they're not recognised, or they're not met with the sorts of the rewards that one would wish for. We absolutely understand that, and I want this to be as much about supporting trusts and clinicians and ICBs to meet those expectations, both, if you like, in supporting in a good way, but also, as I say, the accountability point. And the fact that in January 13 trusts were able to meet that expectation in that one regard, I think is really, really significant. We should be rewarding that. But also some of the work, I mean, you will, I hope, understand that every single week I sit down with Amanda Pritchard and the NHSE team, and we go through, literally line by line, performance targets. We go through individual trusts. We look at where, as I say, there are those trusts where there seem to be particular issues with the longest waiters, for example. What can we do to help improve, help support them to ensure that they're getting through their lists more quickly, and so on. And that, to me, it has to be both a supportive environment, but also an understanding that we will expect, please, leaders to be accountable when things have not gone as we would wish, even when support has been given. So there'll be a lot more on this, James, as over the coming weeks. But we want this. We don't want people to feel defensive about this. We want, please, us to see this as a team effort, and I genuinely think we can achieve it together.
Fantastic. The timer's sort of flashing up 16 minutes, but I don't think we've got another 16 minutes. 3 quick things to do. First thing, say a huge thank you, Victoria, for you giving us loads to think about. The themes work rather beautifully for things we've got ahead to discuss. So big round of applause and thank you to you. And fantastic. Before we all get up, just a little bit of logistics. So our wonderful friends and sponsors from Lilly are running a session with Helen in the chair, facilitating up in, as we pointed out earlier, the wonderfully named Buckingham Room, which is up to the left. You get a sumptuous lunch in there. Some of you smart lot have booked in already, but there are, I'm told, still a small number of spaces and places. So those of you who've got FOMO and want to go and get stuck in, digitally enabled, how can we realise the potential of digital tools to support people to live independent lives? Well, if that doesn't fit into some of the challenges we've been grappling with over the last hour, I don't know what does. For those of you who want to have a sort of networking lunch, you're just over the way, and then you've got a very strict 1:10 p.m. Return back here for a session around AI. So I hope you had a good morning and look forward to seeing you at 1:10.